Good afternoon, and thank you for joining us for today's webinar on oral health and rare disorders. For over 30 years, the National Organization for Rare Disorders has focused on the well-being of people living with rare diseases and their loved ones. To learn more about NORD and to access our resources and events, please visit our website at rarediseases.org. You can also follow NORD on Instagram, Facebook, or Twitter. My name is Katie Kowalski. I work in the education department at NORD, and it is my pleasure to host today's webinar. This webinar is being recorded, and we're going to make it available in the next couple weeks to everyone who registered, so please feel free to share it with others. On June 26 and 27, NORD's Living Rare, Living Stronger Patient and Family Forum will take place virtually. Don't miss this opportunity to participate in sessions aimed at helping you and your loved ones to live your best rare life. Scholarships are available, and you can find more information on the website. And now I'd like to introduce our speakers. Dr. Yoshiyuki Moshira is a clinical associate professor of molecular and cell biology at the Boston University's Goldman School of Dental Medicine. He teaches multiple courses at the dental school, where he also mentors both master's and PhD students. Dr. Mochita established a patient seminar series where rare disease patients provide lectures for rising dental professionals. Dr. Mochita's laboratory research is focused on rare genetic disorders with dental and bone tissue phenotypes. He helps a patient support group for families with various rare dental disorders and has provided public testimonies to support insurance coverage for people with craniofacial conditions. Becky Strong is the outreach director for the International Pemphigus and Pemphigoid Foundation. These are two rare autoimmune conditions. Becky is a patient with pemphigus vulgaris. Her diagnosis journey spanned 17 months, included 6 physician specialists, multiple encounters with their dentist, and several rounds of incorrect treatments. She is a registered nurse living in Michigan with her husband, Tim, and 2 young children. And Jamie Somerville is one of 8 people in her family affected by X-linked hypohidrotic ectodermal dysplasia. In addition to diminished sweat glands and sparse hair, she has 12 missing teeth and severe microdontia. Jamie lives in California and is a guest blogger for the National Foundation for Ectodermal Dysplasias. We're really happy to have you all here, and with that, I will turn it over to Dr. Mochita for introductory comments.
Hello, everyone. Good afternoon. My name is Yoshiyuki Moshira. I'm a dentist and a scientist, and I am full-time faculty member at Boston University School of Dental Medicine, located at Boston, Massachusetts. So I would like to explain who I am by a couple of stories. Number one, what I'm seeing patients, and mainly looking at rare disorders affecting oral cavity. Later on, you may have access to my slides. By looking at those slides, you see 5 types of different teeth pictures. And actually, not all of them are affected by genetic rare disease disorders. It's very complicated, and we need differential diagnosis, which means we have to know how different one condition is from other conditions. That's how I am teaching my young dental students. So I am devoting myself to education and also clinical treatment. The second one is about my research. My research laboratory focuses on dental rare disorders affecting not only tooth, but also soft tissues in oral cavity. So if you look at my slides later, and then you see some animal teeth, which are rats. So I genetically modified the gene and create a mouse model, rat model, to investigate why those genes are causing rare diseases. That's my number 2 mission. The last mission, number 3 mission, is advocacy. Several years ago, I was approached by a small patient group who are affected by rare dental disorders. And then I thought I could give something back to the patient group. That's how I started my advocacy. And if you look at my picture, it is at Massachusetts State House right after I testified against the committee. So that's how I explain who I am. Thank you. So next, Becky Strong, please.
Hi, thank you for inviting me here. I know it's not very often that a patient gets to make a rare disease real. Like Katie said, I have pemphigus vulgaris, and pemphigus is a rare autoimmune blistering disease where about 2/3 of cases actually begin in the mouth. It typically is diagnosed through a direct immunofluorescence biopsy, and most patients have to see 5 healthcare providers over the course of 10 months to get a diagnosis. In a study done by the IPPF, we found that even some patients have to see 10 healthcare providers to get a correct diagnosis, even though most of us do see a dental provider early in our diagnostic journey. Like Katie said, I had to see 6 healthcare providers to get a diagnosis. I was diagnosed with pemphigus back in 2010, but my journey actually began about 17 months before that. In September of 2008, I was under a ton of stress, and I was eating salsa as it's been my primary go-to food. I developed water blisters on the inside of my cheek, and I could run my tongue across them and they would easily go away. But then a few more would come back on the other side, and truly I just thought it was due to the acidic nature of the food that I was eating. A year later, I started getting horrible nosebleeds, and those water blisters came back. And I thought the nosebleeds were just from my allergies, but I couldn't explain those water blisters away. And within a short month, they turned into very painful canker sores. I had an appointment at my dentist, and she told me that I had bad oral hygiene and I just needed to brush more. And I did as I was instructed, but my mouth was getting worse. I eventually consulted with a gastroenterologist, and I didn't know what he could do, but went and he prescribed a magic mouthwash for me that had steroid in it and lidocaine for the pain. And I switched with it, and it made my mouth better. But when I stopped using it, it came back with a vengeance. Since that, my dentist wasn't helping and the gastroenterologist wasn't helping, I went to see my internist, who told me that I had bad cold sores, and he could give me a medicine. They would go away in 14 days, or we could do nothing and they would go away in 2 weeks, even though I told him that this had been going on for months. I begged my dentist to refill that mouthwash, and I completely understand what she said, because that was way too much steroid for somebody to be on. But by January, my mouth was significantly worse, and I had a hard conversation with my husband. I didn't know what was wrong with me. I knew I wasn't being fair to him, and I told him if it got to be too much, he could walk away. I really married a great guy who married me for better or worse, and told me this just happened to be a worse, but he would help me find what I needed. By the end of that month, he made an appointment at his internist, talked to a nice nurse named Becky, who took sympathy on this nurse named Becky, and got me a new patient first-time appointment on a Saturday. That doctor really took a listen to what was going on. We described everything that had been happening in my life, and she sent me for blood work. And my blood work came back normal, with the exception of my ANA, which was off the chart, and a type of white blood cell that was a little bit off. But she didn't understand these oral lesions. And the decision she made to send me to the oral maxillofacial clinic at the university is one that changed my life. They ended up doing a biopsy, taking actually 4 biopsies from 4 different places of my mouth. And a week later, I came back and they told me that I had this rare disease, pemphigus vulgaris, and I would need to see oral medicine, and made an appointment, or they made the appointment that day. And that also I needed to see dermatology, and the dermatologist was waiting for me upstairs. that day was no picnic. And while my husband and I tried to absorb every letter of information that we were being given, it was extremely overwhelming. But I felt like I was going to be okay for the first time, because now we had a name for a disease and a way to treat it. I was put on 80 milligrams of prednisone, 3 grams of Cellcept with topical clobetasol to be used in my mouth and on my body. It was very overwhelming, but I knew I was being closely monitored and watched by a healthcare team that had seen this before. And the first time in months, I thought I might live through this experience and be okay. All of this has been a great motivator for me to give back and to help other patients who are newly diagnosed, because I knew how scared I was and what I went through. And so I decided to come and work for the IPPF full time. I started off as a patient educator, just working part-time, going to universities like Boston University to share my story before coming on full-time at the foundation. And so it's a great way to give back and to advocate for patients like me who didn't have a voice when we're newly diagnosed. And so now I'll pass it over to Jamie Somerville.
Great, thanks, Becky. And my name is Jamie, and I'm here today to represent a patient's perspective in our conversation. I want to tell you a little bit about my own background. I was diagnosed at a really young age with a rare genetic condition called ectodermal dysplasia. And there are over 150 different types of ectodermal dysplasia. But because this condition ran in my family, my doctor was able to diagnose me really young. Ectodermal dysplasia can be diagnosed through genetic testing, but more commonly, it can be diagnosed with just a physical evaluation. So my doctor looked at my mouth and saw that I was missing a lot of teeth. The teeth that I had were really misshapen, and we call that microdontia. And as you can imagine, for my growing up experience, not having a normal smile, not having teeth that functioned the right way, it was not easy. I definitely had solidarity in my family, having 8 other family members who also had the condition. We sort of joke among ourselves that maybe between us all, we have a full set of teeth, but still, it wasn't easy, and it made social situations really hard. As part of my being here today, I did want to also share more about, my own transformation of, and I included some photos in our follow-up resources so you can see the before and after. But more recently, last August, I was able, kind of almost by miracle, was able to get full medical coverage of a lower jaw reconstruction. So I got 10 new teeth, I got a couple implants, and I'm actually still finishing up my treatment, hope to finish by this summer. But I started the process in 2018, and it took me that long to get medical coverage. So I can imagine many of you have a lot of questions about the insurance process. We look forward to hearing your questions and getting into that. But some things I want to highlight are, patient advocates, how to document, going through the appeal process. And I hope to give you some tips that might cut down the process and make it a little clearer and easier. I think, reflecting on my own journey, it took me a little over 2.5 years. And there are things that I know now that would have made it a lot easier and quicker for me to go through the process. So I hope to share some of those tips with you. And I'll close just my introduction by saying that, in working with the medical insurance process, I have found that one of the biggest roadblocks we face is just lack of clarity in medical coverage versus dental and oral health coverage. And so we often sit here thinking, why does oral health have its own insurance? And the answer to that question is like way above my pay grade here. But I will say that my own journey was much easier than some of my family members who had to do this 20, 30 years ago through the work of people like me and others who have had medical coverage and who also advocated on our behalf to change legislation. And I want to highlight, and we'll talk more about advocacy throughout today, I'm sure. But the Ensuring Lasting Smiles Act was first introduced by Senator Baldwin in 2019 into Congress. And it helps to close the loophole that often insurance companies use to defer coverage for rare genetic oral health procedures. They defer that to dental insurance. And this helps to close the loop on that so that people who have rare conditions that affect their oral health can get coverage in the medical space. I was able to advocate with the National Foundation for Ectodermal Dysplasia virtually on the Hill last summer and was able to get my local legislator to co-sponsor the bill. And that was really empowering and encouraging to see someone who represented me to hear my story and also affirm that we needed to get easier access to medical coverage for people like me, like us, who have rare genetic conditions that affect our oral health. So let me just finish by saying I'm really happy to be here and have a dialogue on this topic that's really close to my own heart and my family. Thank you.
Great. Well, we similarly are very happy to have all of you here. Thank you for sharing your really inspiring backgrounds. So during the registration period, we collected a lot of questions from people who have registered for the webinar. So we're going to go jump right into a Q&A period. So for first question, let me ask Dr. Mochita. So as we know, there's over 7,000 rare diseases, and there's a lot of those disorders that have associated impact on dental health. So could you, Dr. Mochita, comment on the range of rare diseases that impact dental health?
Sure. When we talk about oral health, and then, of course, well, you can simply think about teeth, but oral cavity is a more complex organ than you think. So we have not only teeth, but gums, oral mucosa, palate, salivary gland, and tongue, lip. So if you see those, like each tiny organs and sums up and consists of oral cavity, and which makes so many disorders, and it could be so many rare diseases. Actually, I have my textbook. This is a textbook for the dentists who are familiar with rare diseases and head and neck rare diseases. It's like this thick. So it's impossible to remember all of these, but there are so many famous rare disease disorders, and one type can affect only oral cavity. Another type can affect both oral cavity and other systemic organs. So that's how you can think about, there are two types basically. One is only affecting oral cavity, and also oral cavity and other places. So that's how I can comment about so many rare diseases affecting oral cavity.
Right. So at times then, are you called in as part of a larger team of physicians who's treating the patient, and your part would be the dental part? Most of the time, I was contacted by other local dentists or dentists at the Boston University, because they suspect some rare diseases, but they're not sure. Then, I sometimes see those pictures, and probably I am suspecting rare disease A. Then if I have a team of genetic counseling and also a department of genetics at Boston Medical Center, Boston School of Medicine. So I talk to them. It's by a team approach to conclude what might be needed for such a patient. Great, thank you. So, Jamie and Becky, a question for you now. You each touched on your personal experiences with a rare oral condition. So, could you maybe elaborate a little more either on how your oral health was impacted, or perhaps, like Jamie mentioned, other members of her family, how you've seen your condition impact other people's oral health? Maybe start with Jamie.
Great. Let me jump in here. Yes. And because I am one of 8 people in my family with the condition, I will first say that it does provide a lot of solidarity and even just able to compare different severity of this condition. My family, we all have hypohidrotic ectodermal dysplasia, and there are over 150 different types of ectodermal dysplasia. And I will quickly also say to Dr. Mochita's statement here of ectodermal dysplasia does affect your dental and oral health, but it also affects your hair. So we actually have lots of set of dentures and wigs in our household because it affects not just our oral health too. And so when I was really young, because my family already knew that this condition ran in our family, our doctors were able to look out for it early on. And that early diagnosis, which I know is something that I'm really lucky to have, allowed me to get dental treatment and prosthetics early on in life. So when I was really young, I wore little clip-in teeth. And then when I was in 7th grade, I got some new dental prosthetics put into my braces. So I've had all kind of different dental prosthetics. I've had bridge work, implants, crowns, kind of, everything that you can imagine being. And I also have family members who they only have 3 teeth total in their mouth. And so they wear a full set of dentures that are removable. We know other people with the condition who have snap-on smiles and who also have implant denture systems where they have top and bottom, a system of implants put in, and then the dentures can clip into that. I'm sure there are a variety of other ways that people have treated this condition, but I think more commonly with what I see is that the price of oral treatment is so extensive. And if you can imagine, this is a condition that affects individuals from birth. And so as their teeth are growing in, I know like my cousins and myself, we needed new sets of prosthetics every couple of years to kind of accommodate our growing mouth and head. And so that's why I actually had to wait so long. So I'm in my 30s. I had to wait a long time in order to get my lower jaw surgery because my doctors wanted me to wait until my lower jaw was ready to accommodate kind of a massive surgery. So up until that point, I had more temporary prosthetics. So yeah, we give doctors a challenge and a run for their money is what we like to say in my family.
Yeah, that sounds like a rare disease journey. Becky, anything you want to add there just on how you've seen pemphigus and pemphigoid impacting people's health?
Absolutely. So many of us experience a delay in diagnosis or a delay in a biopsy being done to confirm our diagnosis. Because our body is rejecting the desmogleins, either in between the cells in pemphigus or at the basement membrane of pemphigoid, our skin in our mouth and on our body, our mucous membrane is literally shredding. And having that happen is extremely painful, as you can imagine. Many of us kind of look like burn patients when it happens on our skin. But when it happens in our mouth, it makes eating very hard. Myself, I would just even opening my mouth to talk or to take a bite would cause my mouth to bleed and lesions to open. And a lot of times, because we don't have that ability to eat well, we suffer some malnutrition, and we need to look for some good nutrition through liquid diets. I've known other patients that actually have PEG tubes put in because of their inability to eat. Others have lost their tooth or their gums, gum loss just due to the disease. And when we lose our teeth, we also lose the bone in our face. And so because of that, implants aren't necessarily an option for us. We also have undergone a lot of unnecessary treatments and medical expenses. And I'm sure, like many of the people listening today and watching, we've had to fight with our medical and dental insurance to get them to understand while we're having oral symptoms, this is a medical condition. It also takes a lot of time for our healthcare professionals, right? For our dentists at our appointments. I cannot have the ultrasonic equipment used because you will destroy the tissue in my mouth. And I've had suction removed mucosa during dental appointments. So there's a lot of manual work that needs to be done by our dental professionals and careful timing of using topical anesthetics just to get something like a simple cleaning done. There's also a lot of different specialties out there. It's very difficult to know who to go to. Even having insider knowledge before being diagnosed with these disease, I never heard of a specialist called oral medicine or oral pathology until I was diagnosed. And it took a little bit of learning and talking with dental professionals to learn how they played an important role in my diagnosis, but also in my care.
Thank you. Sounds like quite a challenge. So just to delve a little further into patient experience, we hear that, often that people who have quote unquote bad teeth can become really self-conscious about smiling or showing their teeth. So Jamie, I'm just wondering, did you experience any stigma or like social discomfort because of your dental condition?
For sure, I did. Yeah, I was called things like vampire, chipmunk, and you can see I have a photo in my slides that it was really obvious that my smile was not normal, and because of that, it created a lot of social anxiety for me. I remember even at lunchtime, I wouldn't want to take my retainer out because it would bring my teeth out with it. And so as to what Becky said earlier, that you think about your teeth are not just primarily cosmetic, but they have a function. And so if you're not able to chew and eat the right things, it makes it really hard to get proper nutrition. I wanted to share one story. I was thinking about this question, and it reminds me of the first time I got some teeth put in my braces. So I had 2 front teeth. So that was my chipmunk phase. And I got my teeth put in on my braces. And the next day I go to school and I got this question asked, did you get a new haircut? And, I had this brand new smile. And in so many ways, I actually looked really normal. Like for once in my life, had a normal looking smile. And I just love that, that person thought, it must be something about her hair that's different. I got my, most recent set of top teeth at the end of high school. And then my lower set of teeth this past summer. And at this point, I'm pretty comfortable with talking about my oral health, but growing up, it was really hard. I would, cover my smile when I talk, even when I laughed. But now, with the amazing work that dentists have done, they are artists, and they have really helped me achieve a normal looking smile. And I've been able to I've been able to have some healing in that area of my own life. Yeah. Thanks for asking.
Sure. No, and that's great. So Dr. Mochita, I want to ask something about dentistry students. Are they taught anything about rare oral conditions? And then also, both Becky and Jamie have mentioned, Becky in particular, a longer diagnostic journey. So if dentists suspect a rare condition or something that's not diagnosed, how do they talk with the patient, and how do they appropriately refer the patient to the appropriate specialist?
So at most of the dental school, I believe, as Becky told us, there are some special courses by oral pathologists or oral medicine. Basically, oral pathology is one of the courses which I believe at the Boston University, 30-year students are going to have, and they study about. But in reality, instead, our education is more mainly focusing on two major dental diseases, dental caries and gum disease. So when they go to see patients, most of the patients, majority are suffered by those two dental caries and gum diseases. And then, although they have learned some aspects of rare disorders, diseases, they might not remember those conditions. Plus, as patient numbers are so small, sometimes there is no established treatment, special treatment for those conditions. That's probably a problem for any either dental education or dental treatment.
Thank you. So in researching the different literature and sites for this webinar, we did learn that the patient advocacy organizations play a really central role in helping people with rare disorders find qualified health providers. So Becky, I wonder if you might share with us from the perspective of a patient advocate, how your organization helps to find qualified specialists, or how advocacy organizations in general can help connect patients to qualified specialists.
Yeah, absolutely. Here at the IPPF, we maintain a map of medical and dental professionals at no cost or preference to any of the physicians listed. The purpose of that map is to have an interactive 24 hours a day, 365 days a year access to contact information for medical or dental professionals who the IPPF believes are familiar with pemphigus and pemphigoid. We know that MAP isn't inclusive by any means, but it has been developed from contact with pemphigus and pemphigoid treating physicians, recommendations from patients, and even referrals from other physicians. Pemphigus and pemphigoid are probably not unique. Like many rare disease, our specialists do tend to hover around major medical learning institutions. And so our doctors are very familiar with our disease, but they also probably know other specialists, and many times our doctors have developed their own network of providers. So if you are seeing a patient with a rare disease, or if you're seeing a specialist for your rare disease, ask those providers. That's a really great resource, because they've probably had to refer a patient for something that you're experiencing, and they might just know who to send to. So ask around, join, online discussion platforms that can connect patients from around the world, and ask if somebody's from your area. Who are you seeing? Join those regional support groups and talk with the other patients. Ask who they're seeing in your area if they've had a problem. And those are really great ways that we work to connect patients with providers.
Great, thank you very much. And I'll just add here, at NORD, we get calls all the time from patients looking for support. So we're not going to be able to talk about all the different rare dental conditions, but if you need to be connected to an advocacy organization, contact NORD, and we'd be happy to try to help you make that connection. So now the topic of dental insurance has been mentioned, and there were a lot of questions from our listeners. So I want to jump into insurance. And first, I'd like to address a question to Dr. Mochita. In the United States, we know that dental and health insurance are two totally different types of insurance. So just wondering, why is oral health considered separate from overall medical health?
Okay, historically, those two insurances are separated, but for treatments, I think any modern medicine is so much compartmentalized. And even in dentistry, there are so many specialties. Well, we have 4 years of doctoral dental medicine education, but after they graduate, if they want, they go to each one of the specialties for 2 years or 3 years, and then they become specialists, just like physicians. So although they are separated, they are so familiar with that aspect of special treatment care, which is a good thing. But on the other hand, that's how those two entities are so much separated. And then patients are struggling with such as like, insurance coverage and so on. That's how I can comment on.
Right. So I do understand that there are situations where dental care is considered a medical necessity, and therefore it's going to be covered through the more traditional health insurance. Jamie, can you comment on that and maybe how that worked in your experience?
Absolutely. Yeah. I mean, we can camp a lot here, and I know there's probably going to be other questions related to insurance, but for the medical necessity part, there was what I would first recommend, and I'll share this again later, but when you look at evidence of coverage or like an EOB or EOC in insurance plans, they often will say medical necessity has two components. There's normal appearance and normal function. And so for my case, we had to advocate that this lower jaw reconstruction was achieving both of those things, the normal appearance and normal function. So that's typically when you hear that, the phrase medical necessity, that's what insurance companies are looking for when getting coverage for treatment.
Great. So Dr. Mochita, does the dentist have a role then in determining whether there's this quote unquote medical need for dental intervention? Or is it a medical doctor, or is it both? Like, who makes that determination?
I think for any function in the oral cavity, it should be by dentist. It's like, I'm giving an example. It's actually even like something that occurred to me before I became a dentist. My permanent tooth was extracted when I was young. And then what happened was, the neighboring teeth are just leaning almost like to fill the space. Then my occlusion is messed up. So that's a loss of function, and that needs to be evaluated by dentists. And I don't think a physician would understand how the occlusion is abnormal or not. So in my opinion, dentists needs to be recognized as the physician of the mouth, and we treat in that way.
Great, thank you. So a question for Becky and or Jamie. What's the common experience you see in your rare patient population with trying to obtain insurance coverage? Are you seeing other people having difficulty obtaining the insurance they need, and are you able to provide assistance for them with getting insurance coverage?
Yeah, for pemphigus and pemphigoid, our conditions happen typically in adults. And so many times we do have insurance coverage, but then it becomes a matter of appeal, and appealing and fighting and advocating for yourself truly becomes a way of life. And a lot of times we, will reel in our physicians that can help write letters, we'll spot legislation that has been covered in the past or exceptions that will help us. And so really pulling in all of the experts is what we ask our community to do. And also patients become great researchers themselves, exploring the scientific publications and showing proof that what they're asking for is a beneficial treatment. And so truly just never stop asking and trying to get insurance, trying different plans if you lose your insurance, asking physicians if they can help you, exploring nonprofits associated with your healthcare system. They may be able to help defer and cover some of your dental expenses as well. If you're going to a university or a local dental school, that might be a way to help defer some of the cost as well. And they're overseen by faculty like Dr. Mochita, who are familiar with these diseases and can really be a great resource to the student who is helping and working on you, but also to you. And like I said, there might even be a nonprofit fund at the university. And so if you, at the end of the day, if you have insurance and you're denied coverage, never stop appealing that and using all of the resources from patient organizations to your own doctor's offices to universities to the medical librarian at the local hospital to find those articles that can support what you're asking for is truly a medical necessity and that can help better your quality of life.
Great, really useful. And Jamie, I'd love if you and Dr. Mochita, if also you're welcome to jump in and just sort of, elaborate on, experiences with trying to obtain insurance coverage and your top tips. Those were some good ones, Becky.
Yeah, I can jump in here. I think about this question, and I will also say that I linked my blog post that I wrote kind of documenting my own journey. So in our follow-up resources, be sure to look at that. But I thought of 6 and they're quick. So my top tips for people who are trying to get medical coverage would be to research what other people with your condition have also, like the successes that they have had. And you can get connected with a lot of advocacy organizations. So I use the National Foundation for Ectodermal Dysplasia. They actually have a dental or medical insurance toolkit, and I downloaded it, printed it out, and that really helped. Second tip would be to document everything. I just started a running document of I scanned every document that I got from my insurance company, from my doctors, everything, even a call log, everything is documented. You'll probably have a very thick binder at the end of it if you're trying to get a surgery covered. Another tip that I hadn't thought about before doing all this, but I actually called my health plan and asked, do you have patient advocacy services at my health plan? So I had Blue Shield of California. I was connected with a patient advocate, and she is the person who helped me get some initial approval in my own surgery case. Tip 4 would be to, I know Becky had said appeal. There is an insurance commissioner for every state that's a regulatory agency, and they actually make sure the insurance companies are applying or are in I'm stumbling over my words here. They make sure that insurance companies are compliant with state and federal law. So I wish that I appealed sooner, but I appealed to the Department of Managed Healthcare in California and was able to get a specialist. Like Dr. Mochita said, it's so important that a professional who's experienced in this specialty can review and determine medical necessity. So they actually had a specialist of my condition review my case and determine that it was medically necessary. 5 would be to talk to your company's HR. If you have your medical insurance through through a workplace, or if it's through another means, try to get the full evidence of coverage. It should be over 100-page document, and you can actually do a search within your evidence of coverage and see if there's specific clauses that cover your condition. I recently switched insurances and I got the evidence of coverage, and actually just did a search, and I actually found that they have a clause that says, we cover ectodermal dysplasia. And I thought that it was amazing that someone advocated for that. The last tip I have here is I actually called my human resources department at my company and asked if they had any free advocacy for health plans. And so I was actually connected with another advocate who helped in the appeal process. So I know that was a lot, but those are my top tips that I could think of.
Those are great ones. Thank you very much. And our time has passed so quickly. I just wonder, Dr. Mochita, did you want to jump in with any final thoughts on, obtaining medical coverage? I know you've advocated to help support people getting coverage, or any other additional thoughts on topics we haven't covered that you'd like to share.
Yeah, while I was listening to the stories, and then something came up to my mind that sometimes it's, well, for example, 25 years ago, any types of rare disorders cause is unknown. But now, most of the causes, genes are identified and discovered. And then, because of the technology's development and the progress, you can Google, type the name of the disease if you know, and then you probably get to their expert, and you can email them or call them. That's how I am approached almost like once a month by certain tooth disorders, rare disorders. Then probably they do not know that's not only affected by mouth, but also ear. But you can't probably get the right information by Googling on the website. So that's probably important to reach out to someone who knows the condition better. And then the patient may think that, it might be associated with that condition. And then, they treat as a complete whole picture of the disease. So that's probably important to know.
Great. All wonderful information. And I just want to remind everybody who's listening that we are going to be sending out a recording of the webinar along with slides, and those will contain links to resources. So I regret that our time has come to a close so very quickly, but I want to thank you, Dr. Mochita and Jamie and Becky, for sharing your incredible experiences with our audience. And we will be sending out the slides, as I just said. And lastly, right after the webinar, you're going to receive a very short survey, and we would be most appreciative if you complete it, because it helps us to develop future webinars. So thank you again to our speakers. Thank you to all of our listeners for joining us, and please enjoy the rest of your day.